Welcome to this week's edition of the Health Ministry Week in Review. Here's a recap of our latest developments. On Friday, March 7th, the Ministry of Health received a donation of medical supplies valued at 6.5 million Guyana dollars from Food for the Poor Guyana to enhance maternal health care services at Baramita Cottage Hospital. During the handover ceremony, Minister of Health Dr. Frank Anthony highlighted the transformation of Baramita's healthcare facility, which has progressed from a health post to a fully functioning cottage hospital.
What we've been able to do at Baramita is extraordinary. We have started from health posts where we had one community health worker, and the services at that time was very minimal. And we have grown over the last couple of years to now where we have moved it from a health post to a health center to now a cottage hospital. We had to improve the infrastructure to make sure that we can have inpatient facilities and also the quality of the personnel that we have working there. This donation is going to help complement that vision.
Thereafter, Minister Anthony attended the launch of a support group for first-time hearing aid users. This initiative was geared to assist individuals in adjusting to their hearing aids, addressing any residual effects after fitting, and providing essential guidance. Speaking at the launch, Dr. Anthony noted that before 2021, individuals had to pay 65,000 Guyana dollars to acquire a hearing aid. However, in 2021, the government of Guyana made hearing aids free of cost. On March 8th, the government of Guyana launched the Newborn Cash Grant Initiative under the theme Supporting New Beginnings. Through this initiative, Guyanese mothers all across Guyana will receive a one-off cash grant value at 100,000 Guyana dollars to support their newborn needs. Speaking at this event, the President of Guyana, His Excellency Mohamed Irfan Ali, stated that the grant must not be seen as a cost on the country's treasury, but as a deposit into our children's future.
We are planting seeds for a future where every child has the tools to grow, succeed, and lead. This is not a burden on today's taxpayers. It is a commitment to tomorrow's leaders and nation builders.
Meanwhile, the Health Minister, Dr. Frank Anthony, highlighted the government's ongoing efforts to improve healthcare for all mothers and children.
In the interior of our country, because previously, mothers, when they go into labor, they had to travel all the way to get to the hospital. Sometimes that's a journey of 3 hours, 4 hours, and in many instances, they will give birth along the way to the hospital. What we've been able to do now is to build homes in the compound of our hospitals in the different parts of our country, and we call them waiting homes. So before a mother go into labor, the mother can come there, wait until she goes into labor, and then she is transferred from that waiting home into the hospital where she can give safe birth.
On March 12th, Minister Anthony received a courtesy call from the newly appointed United Nations Development Program resident representative, Mr. Berdy Berdiev. This call served as an introduction and discussions on areas of mutual interest. On the following day, the Ministry of Health's School Health Department received data capturing servers along with 20 tablets to aid in the department entering data electronically. The said day, Minister Anthony attended the launch of the National Health Information Systems and Technology Workforce Development Program, the US $100 million program, which was launched by Greater Guyana Initiative in collaboration with HES Corporation, ExxonMobil Guyana Limited, and China National Offshore Oil Corporation, will see the birth of the Guyana Digital Health Training Institute, a partnership between Mount Sinai Health Systems and the Ministry of Health. Speaking at this ceremony, the Health Minister said that the ministry has recognized the need for digitalization to enhance healthcare delivery.
If we don't digitalize, it is going to be a problem for us. And so we came up with a strategy that we want to introduce electronic health records across the country. We are going to use the Georgetown Hospital as the pilot site. So we want to start with them first and all the satellite facilities that they have.
This has brought us to the end of this week's edition of the Weekend Review. Stay tuned, we will be back next week.